Okay, hi, how are you today? My name is Martha. I'm going to be your nurse today and I'm going to perform a motor exam. Is that okay with you?
Yes, it is.
Okay, perfect. Can you please tell me your full name?
Jose Rodriguez,
Okay, and can you tell me where you are?
in Apollo Beach.
Okay, do you know what time it is?
Almost 2 o'clock.
Okay, great. And I'm also going to do a test and I want you to count from zero, starting from zero, count by eights, and I'll tell you when to stop.
0, 8, 16, 24, 32, 40, 48, 50.
You can stop. Perfect. Now we're going to continue and we're going to assess and inspect the skin, hair, and nails. Okay, so I'm going to go ahead and start by looking at the skin. I want to make sure that we're making sure that he has no wounds, no lesions, redness, any uneven hair distribution, and I'm gonna look at his hair, make sure it's even. Yes, it's nice. It's got a lot of hair, no baldness, no flakiness. And then I'm gonna feel for the skin too, for the temperature. So I'm just gonna palpate. Okay, and then can I look at your nails, please? I'm gonna check for any cracks, any I'm gonna look at the cuticles too. I'm gonna look for capillary refill, make sure that the patient is hydrated. So I'm just gonna do the capillary refill, pink to white, perfect. I'm also gonna do what is called a Turgor testing. I'm just gonna pinch the skin a little bit to make sure that you're hydrated. Yep, perfect. Perfect. We can even check the top of the hands, and you're very hydrated, which is very good. Oh, and then just a pinch here. And then I'm also gonna check the toes. We're checking for any yellowish of the nails. Check for capillary refill and capillary refill. Perfect. And I'm also gonna check for any clubbing. Okay, so if you can just put your hands together for me like this. Yep. And we're gonna just check for clubbing. Perfect. No clubbing that I can see. All right. Now we're going to go ahead and move forward and do the head, face, and neck assessment. And I'm just gonna look and inspect the head first and make sure that it's evenly, it's sitting right on where his shoulders aligned. And we're also gonna look around, make sure that it's no abnormalities. Look up for me, thank you. Okay, and then I'm also gonna check for the frontal and the maxillary sinuses. So I'm just gonna press here. Does this hurt?
No.
Here?
No.
No? Okay, perfect. And then I'm gonna go ahead and do a couple of facial assessments, and that's to assess the nerves, okay? So if you can raise your eyebrows for me. Perfect. Can you smile? Good. Can you frown? Good. And then can you go ahead and put, like if you're gonna whistle, purse your lips a little bit. There you go. And then can you also puff your cheeks for me? Very good. And then I need you to, I'm gonna perform a test on you with this cotton ball, and when I touch you, I just need you to tell me if you can feel it or not. This is just to check the sensation of the branches of your nerves, okay?
Okay.
Okay, here we go. Go ahead and close your eyes for me.
Feel it. Feel it. Feel it.
Oops.
Feel it. Feel it. Felt that too.
Okay, perfect. Now we are going to go ahead and feel for the trachea. We're gonna make sure that it's aligned perfectly. So here I can feel it's straight. We're gonna check for tracheal tug, and the way we perform this test is by, he's gonna take a sip of water, you're gonna hold it, okay? And then I am going to press and deviate the trachea, and we shouldn't feel anything, but if we do, we'd feel for nodules or anything like that, okay? So go ahead and take a sip of water.
Okay.
And we're gonna assess first the left lobe. Okay? Okay. Hold it in. Alright. Now lean your head this way to your left. Very good. And then I'm gonna deviate. Go ahead and swallow. Good. Same thing. Take a sip. Don't swallow. Hold. Okay. Your head to the right. ahead. Okay, perfect. Did not feel anything. Now we're gonna check your shoulders. So go ahead and turn your neck to your left side and to the right. Shrug your shoulders for me, up and down. Very good. Now I'm gonna shrug. You're gonna shrug them again, but I'm gonna make sure that without resistance. With resistance, sorry. Okay, very good. Alrighty. Now we're gonna move on to your eyes. And on your eyes, we're gonna be inspecting your eyes, your pupils, your sclera, your eyebrows, the iris, the conjunctiva. Okay, so I'm gonna feel first. I'm gonna palpate the preorbital areas. Any pain or anything like that?
No.
No? Okay, perfect. All right. Now we're gonna test for an eye exam. So this is done with the rosin card. So what you're gonna do is you're gonna cover one eye and you're gonna read from the last line or the line that you can read. Do you wear any glasses at home?
No, I don't.
No? Okay, perfect. Go ahead and cover your eye and read.
37428 EW MXXO 5220/30.
Okay, 20/30, perfect. Now I'm gonna do the same thing. Hold it here on this side. Yep, 14. Yep.
It's 37428 EW MXXO 5220/30.
Okay, perfect. Now we're gonna check for peripheral vision, and the way we check for that is you're gonna cover your eye, one of your eyes, and I'm gonna cover my eye. Okay, and then once you see my hand, just tell me that if you can see it.
I can see it.
Okay.
I can see it. I can see it.
Okay. Same thing. We're gonna cover the other eye. Same thing.
I can see it. I can see it. I can see it. I can see it.
Okay, perfect. Now we are going to do the peripheral. We're gonna do the I'm gonna check for the pupils. Oh, I have my pen light in my pocket. Sorry. Okay, and now we're gonna do the pupil exam. So I'm gonna check for pupil and accommodation as well at the end. Okay, so just look forward. Okay, you should see the pupils constrict and they constrict. Look forward. Very good. And then I'm going to also cover this eye here on this side. Ready?
Mm-hmm.
Just look forward. And I'm gonna be looking on this side too. And then I'm gonna cover this side up. Sorry. Got my hand left and right confused. Okay, ready?
Mm-hmm.
Look forward for me. And I'm looking at the other eye. Okay. And then now we're going to check for accommodation. And what you're gonna do is you're gonna look forward and then you're gonna look at my finger. Okay, so just look forward and focus on my finger. Ready? Look forward again. Very good. And that should bring your eyes together to check for accommodation. And then I'm gonna do the one last test that we're gonna test for. And I just want you to follow my finger, okay? So you see my finger? Very good. Very good. Perfect. Okay, now we're gonna do the ear, nose, and throat assessment, okay? So what we're gonna assess for first is gonna be your ears. We're gonna look and inspect that there's no drainage, anything like that. So I'm gonna look in the front and the back. Nothing here, clean ears, okay? They look symmetrical, nothing abnormal. And then we're gonna do what is called a test, a whisper test. And what I'm gonna have you do is cover one of your ears. Yep. And then I'm gonna whisper 3 things to you and just tell me what it is. And then I'll come back to the other side. Ready? 1, 2, 3.
1, 2, 3.
Okay. Cover the other ear. Perfect. A, B, C.
A, B, C.
Okay, perfect. And now we're gonna do what is called the Renning and the Webner's test. Unfortunately, I do not have the tuning fork, but so we're gonna skip through that. But I will define what it is, which is when you're doing the Renning and the Webner test, we're checking for vibrations, hearing tests of the patient, and so yeah, unfortunately I don't have that, so we'll bypass that. And then now we'll just go ahead and check on the nose. So if that's okay, we'll continue and do the nose. We're gonna check for symmetry again, make sure that his nose is straight. I'm also going to palpate it. Any pain? No? Okay, perfect. I'm gonna look at your nose. Is that okay?
Yes.
Okay, I'm just gonna look in there, making sure there's no drainage, any crustiness or bleeding, nothing that I can see. We're also gonna take a look inside the patient's mouth. Can you open your mouth for me? Perfect. We're gonna look in there, and we're gonna look at the roof of the mouth, the mucosa. Can you lift your tongue up? Bucca. The floor of the tongue. We're gonna look for cavities, which I see one and a missing tooth, it looks like. You have a missing tooth? Okay. Okay, perfect. Now, what I'm gonna have you do is, I'm gonna put my gloves on. Okay. Okay, I put my hand sanitizer. Sorry, not able to open that thing. And I'll put my gloves on for this exam. Okay. I'm going to go ahead and open your mouth for me. Ah, say ah. We're gonna check the nerve. I say ah, put your tongue out and press down. Okay. And then I'm gonna look at the tonsils in the back. And have you had your tonsils removed? No. Yeah, I can see they're about 2+, no swelling. Any problems back there? No? Okay. I don't see any infection going on. We're gonna also just check a look at your lips. You have a little bit of drying. Maybe you should put some Vaseline on there to keep that moist so they don't crack. I'm going to also have you stick your tongue out for me. Go ahead, stick your tongue. Okay, and can you move it to left and right? Very good. We're gonna check for the other nerve, the hypoglossal nerve. And then I'm going to take my gauze and take your, go ahead and say ah. Stick your tongue all the way out, all the way out. Okay. Gonna look at the tongue, gonna inspect it. No lesions that I can see, no ulcers, no bleeding. Perfect. All right. Go ahead and remove my gloves. And I would sanitize my hands. Okay. And then now we are going to go ahead and move on to our chest assessment. Okay. We're gonna do anterior, posterior, and lateral test. If we heard anything abnormal during the exam, we would do what is called a bronchophony, bear with me with the names, a bronchophony, an echophony, and then the whisper pectoral ague testing would be done. Sorry about the words. Okay, so now we're going ahead, go ahead and inspect the chest. Can you please remove your shirt? Thank you. And we're gonna check and inspect the skin first. We're gonna look for any, we're gonna look for his breathing, if he's using any accessory muscles, his respiratory rate. We're gonna check for any lesions, and I don't see anything here. And I'm going to palpate. Tell me if this hurts.
No. 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 No.
No. Okay, good. Now I'm gonna take a quick listen and auscultate. Deep breath. Deep breath. We're gonna go ahead and assess the patient for the posterior and lateral back, and then we're gonna check for respiratory rate, even respiratory rate. We're gonna also assess for any wounds, anything on the torso. We're gonna check for any use of accessory muscles. As you can see, he's breathing non-labored. So now we will go ahead and go ahead and palpate. Now I'm gonna percuss right in between. Okay, now I'm gonna go ahead and we're gonna feel for, I'm gonna have you say 99 for me, and we are checking for tactical firmitis. So go ahead and say 99.
99. 99.
Very good.
99. 99.
Very good. And then now we're going to check for thoracic expansion. So I'm going to put my hands under his rib cage. Go ahead and breathe. Inhale for me and out. Very good. Again. And then we're just assessing the thoracic cage. Now I'm going to go ahead and take a listen. Deep breath. Very good. Very good. Alrighty, lung sounds are clear, and now we are going to go ahead and do check for the CVA, and that is checked by down here, pretty much making like a V, and I'm going to check by we're checking for kidney inflammation. Sorry, I almost forgot the words. That's what we're looking for. We're checking for any kidney inflammation. And I'm just gonna tap it with my arm. Any pain?
No.
Okay. Any pain?
No.
Okay, perfect. Now we're going to go ahead and move on and listen to the heart. We're gonna listen to the 5 cardiac sounds. If I can have you just lay down for me. So swing your legs this way. Put your head down on the pillow. Very good. And first we're gonna inspect the chest. We're always going to assess and inspect for any lift, any heaves, any shortness of breath. No? Okay. And we're going to do the 5 cardiac markers to check the heart, which the one is the aortic valve, and that is located at the second intercostal space, and that is on the right sternal border. And then the pulmonomic, which is on the second intercostal left sternal border, and then going down the line is the third intercostal space, and that's the Erb's point, and then the 4th intercostal space, and that is the tricuspid, and the last one is the mitral valve, and it's going to be mid-clavicular line, 5th intercostal space. And now I'm going to go ahead and palpate. So I'm just going to touch gently And then I'm going to auscultate. I'm going to listen with my diaphragm. Very good. And I'm also going to listen with the bell. And if I was going to turn around the bell, I would turn it this way to listen. Also, the S1, it is the S1 is due to the closure of the mitral and tricuspid valve, and the S2 is due to the closure of the mitral and the pulmonic valve, and I'm sorry, the aortic and pulmonic valve, sorry. And then if I was going to be, if I heard a murmur, you would hear it at the S1 if it's systolic murmur, and if it is diastolic murmur, you would hear it at S1 after, S2 after. And if we heard any abnormal sounds on the patient would need to sit up and lean forward, or he would turn on his left side lateral, and we would be able to get the heart closer and be able to listen clearly to those sounds. Okay, now I'm going to check for the temporal arteries, the carotid arteries, and I'm also going to check for pulses, and I'll name the pulses as I go. So I'm going to check first, listen to the temporal arteries, okay? And the carotid, we only do one at a time. Okay. Now I'm going to feel with my hands, okay? Temporal and carotid again, only one at a time. And over. Very good, perfect pulses. Now I'm going to check the brachial. Go ahead and put your arms here. And check for brachial pulses, good. And then the radial by the thumb, perfect. Now I'm going to check the popliteal. I'm going to bend your knees. It's okay, I'm just going to feel for the popliteal, very good. And behind the knee, check for pulse, perfect. And then I'm also going to check the dorsalis, the DS, perfect, right on top. And then the posterior tibia, and then there's that. Okay, now I'm going to assess for the abdomen, okay? And for the abdomen, we're always going to inspect first. We're gonna make sure you can lay flat, you're still doing good. We're gonna just check for abdomen. We're gonna check for any masses, look, and we are going to always assess, auscultate, then palpate, okay? So we also are looking for, make sure the umbilicus is in the right place. We're also gonna check for any visible peristalsis, and I don't see anything here. And we're also going to go ahead and listen to the 4 quadrants. Okay? Go ahead and listen. Now I'm just gonna go ahead and palpate. Does this hurt? No. Any pain here?
No.
Any pain here?
No. No.
Okay. We're also gonna feel for the umbilical aorta, and that is gonna be right here above the umbilicus. Okay. Now I'm gonna push a little deeper. Palpate. No pain?
No.
Okay, good. And then, you okay?
Yes.
Okay. Thought you were looking at something else. Okay, perfect. Now we're going to do the abdomen. Okay, perfect. Okay, and now we're going to just, the last thing is to assess for the liver and the kidney, okay? So I'm gonna press down on here, and I want you to take a deep breath. Okay. And I don't feel anything here, so that's a good thing because we don't have any enlarged kidney. Sorry, liver. For the kidney, I'm gonna put my arm under, and then I'm gonna press down again. Go ahead, take a deep breath. Very good. Same thing on this side. Okay, go ahead. Very good. Okay. And now we're gonna do the muscle skeletal assessment. So if I can have you swing your legs around and sit up for me. Okay, perfect. Now for this test, we're gonna check for the muscles. We're gonna check the joints. Make sure we're gonna look for any swelling, edema, any deformity of the muscles there. And so let's go ahead. Oh, I'm sorry. I need you to lay down. That way, no, this way, the way you were facing. I'm sorry, we have to do the legs first. We're gonna do the hip. So sorry, that's my fault. So we're gonna do the hip extension. So we're gonna extend your leg this way out, and then inward, like this, and we're gonna swing it back this way. That's a adduction, okay? So remember, leg out, and then swing forward, adduction. And then same thing with this leg. Do it. Swing that way. Okay. Bring it all the way over. Very good. Go ahead and lay it flat. Now we're going to do flex. So, flex. Very good. Do the other leg. Flex. Very good. And then now I'm going to have the sole of your foot touch your knee. Like this. And then this is going to, yep. We're going to do inversion external and internal. There you go. Lay it flat. Okay. Can you do the same thing to the other leg? Very good. Yep, lay it and then come back. Perfect. Lay it back down. And then feet. Okay. Now we're going to check for your hip strength. So go ahead and put your leg out for me. Don't let me put it down. Very good. Good, good, good. Same thing with this one. Okay, go ahead and lay it down. Very good. And now I'm going to have you sit up. Very good. Sit there. And then we are going to do a head tilt, down, chin down, and chin up. And then down, look straight forward. And then we're gonna do left and right. And then you're going to look forward, tilt your head this way to your, yep, ear to your shoulder, ear to your shoulder, and then look straight. And then I'm going to bring your head forward. Don't let me push you. Don't let me push you. There you go. And then same thing, push back, okay? And then we're going to pick your arms up, go like this, and extend them over. And then bring them forward, cross this way, and release. Now you're gonna bring them behind your back, and then in the back of your head, and then put your arms straight forward. Okay, now I'm just gonna check your strength, and up, don't let me, there you go. And then we're gonna do your elbows. Do your elbows, extend and flex. And then your wrist open like this. You're gonna do, yep, palms up, palm down, up. And then you're gonna squeeze, there you go. And then have your elbows like this, there you go. I'm gonna push, don't let me push, don't let me push. And then don't let me pull, don't let me pull. And then hands, palms up, up, very good. I'm gonna push, push, and push, very good. And then I'm going to go ahead and open your hands, flex, extend, sorry, flex, extend. And then don't let me push, don't let me pull, there you go, okay. And now we're gonna do your, go ahead and relax your arms. We're gonna do your knees, okay? So this knee up, very good, down, flex back down, pick it up, and back down. And then I'm gonna also test the strength. So don't let me push, don't let me push, okay, and pull, pull, push back, push back, push back, very good. And then now we're gonna do the feet, feet up, toes up, sorry, toes down, very good. And then we're gonna check also your feet. So I'm gonna push on your feet, push, and then up, okay. Now I'm gonna have you put the soles of your feet together, very good, good. And then extend them out, there you go, perfect. Now I'm gonna have you stand up for me, and then you're gonna just face the camera that way, okay, very good. And then you're gonna swing your knee back like this and hold it, there you go, good, don't fall. All right, same thing with the other one, okay. And then you're going to go forward, touch your toes, okay, very good. And then you're gonna, okay, that's good. We're gonna hyperextend back, bend your back right there, up to that, that's good, okay. And then now you're gonna do some rotations. Go ahead, rotate like this and like this. And then now you're going to do a lateral bending. So you're gonna go this way, there you go, and then lateral bending this way, okay. And then that's it, we're all done.